I want to start this one a little differently. Think about a professional you've trusted, a doctor, a teacher, a counselor, someone who is good at their job. Chances are, when you think about why you trusted them, it wasn't just because of their technical skill, it was because of how they treated you. Whether they kept things private, whether they were honest with you even when honesty was harder than reassurance. That's what ethics is about, not a list of rules to memorize, not a checkbox to clear before you pass the exam. Ethics is about who you are when no one is watching. The RBT Ethics Code 2.0 was published by the BACB in 2021 and went into effect on January 1, 2022. Every RBT must agree to abide by this code as a condition of certification. Violating it can result in losing your certification. The entire code is built on 4 core principles. Think of these as the values that drive everything else. When you face a situation the code doesn't give you a specific answer for, and you will, these 4 principles are what you come back to. Principle 1, benefit others. Everything you do should improve outcomes for your client. Principle 2, treat people with compassion and respect. Every person you serve, regardless of their diagnosis, their behavior, or their background, deserves dignity. Principle 3, behave with integrity. Be honest in your data, your notes, and your relationships. Principle 4, demonstrate competence. Only do what you are trained and authorized to do. Let me bring this to life with some real scenarios, because abstract principles are easy to agree with. It's the specific situations where it gets hard. Scenario 1, you have a fantastic session and you pull out your phone to type an Instagram caption. Had the best session today with my little guy. He's 5, he has autism, and he finally said more. You didn't use his name. You didn't post a photo. So that's fine, right? It's not fine. Here's why. You shared his age, his diagnosis, and your approximate location based on where you practice. For anyone who knows this family, that is enough to identify a real child. Confidentiality doesn't mean no names, no photos. It means client information stays private, period, even when your intentions are wonderful. Scenario 2, a family you've worked with for a year hands you a wrapped box. Inside is a $75 gift card and a note that says, "We don't know what we'd do without you. You're part of this family." That note is genuine. But the RBT Ethics Code is explicit. RBTs do not accept gifts from clients or clients' families. The reason isn't about the money, it's about the relationship. When you accept something of value, it changes the dynamic and blurs the professional boundary. It can make it harder for you to do your job objectively. Thank them warmly, explain your professional guidelines. Don't allow you to accept gifts and then consult your supervisor. Scenario 3. A parent says, "I read about a new technique online. Can you just try it today?" You don't have to tell your supervisor, "I just want to see if it helps." You do not implement it, not if it seems harmless, not even if your gut says it might work. Your role is to implement the plan that your BCBA has designed and authorized. Anything that requires you to hide something from your supervisor is a signal you shouldn't be doing it. Thank the parent for caring, tell them you'll share the idea with your BCBA so it can be considered, and then actually do that. Most ethical mistakes happen because someone wasn't sure what the right thing was, and they made a decision without asking. The RBT Ethics Code says that when RBTs are unsure how to apply the code, they should rely on their BACB-required supervisor. That's the rule that covers almost everything. When you're not sure, ask your supervisor, in the moment or as close to it as possible. You are not expected to be a perfect ethical decision maker on day one. You are expected to ask for help. The clients you will work with are real people, not cases, not data points, people. And they deserve to be treated with dignity, respect, and genuine care. ABA at its best is a science that serves that humanity. Follow the plan, collect real data, stay within your scope, ask your supervisor when you're unsure, show up, do the work. The field of ABA needs practitioners who care about the work they're doing and the people they're serving. Go be one of those people. You're ready. That's it for the lesson videos. I'll see you in lesson 3. Congratulations on completing lesson 2. In the next module, we'll cover lesson 3, operational definitions and continuous measurement. See you there.